Hello everyone, this is Shadi Reyes. Today I'm just going to give you a quick update on ACC. There was a lot of major trials presented, but I'm going to focus on a couple of interventional trials. The first one is BioVasc. BioVasc was a randomized trial looking into immediate revascularization for patient with multi-vessel disease compared to patient who have a stage intervention. The outcome of this trial was similar in terms of if you do it right away, the same setup or the same procedure, compare if you wait later, and there was no difference in terms of hospitalization, cardiac death between the two groups. The second trial, which is very important, which is the Revive BCIS2. This trial is looking at the patient who have abnormal ejection fraction and has an extensive multi-vessel coronary artery disease. These patients were randomized to optimal medical therapy, like very extensive optical medical therapy compared to PCI guided therapy. Both therapies were comparable. There was no difference in outcome, and especially in the patient who have multi-vessel coronary artery disease underwent PCI. There is some caveat about this, is the fact that there's a group of the patient who underwent a viability study that showed hibernating myocardium. There was kind of no difference in terms of outcome as well in this cohort of patients. The next study is BMAD, this is a trial looking at a percutaneous heart monitoring. It's not percutaneous, it's actually a cutaneous heart monitoring in patient with advanced heart failure, patient who don't qualify for a life vest, the ejection fraction above 35, but still have signs of heart failure and accumulation of fluid, as well as looking at the water and the fluid impedance across the lung. This is a very positive trial suggesting there is a decrease in rehospitalization as well as a decrease in patient readmission and patient with heart failure and with fluid overload. Positive study, another option for patient with heart failure who require monitoring at home instead of bringing back to the clinic or coming back to the emergency department with fluid overload. One of the major trials also was presented there is Trilominate. This is a Trilominate trial that focuses on patient with severe mitral regurgitation, with like a wide open tricuspid regurgitation, patient with RV failure who have severe symptoms of shortness of breath, ascites, liver congestion, and edema. This was a very interesting study comparing medical therapy compared to transcutaneous TEER or TEER for patient with severe mitral regurgitation. Again, the clipping of the tricuspid valve was not beneficial in terms of changing the patient outcome or mortality at 30 days. However, there was much improvement in the patient's symptoms of heart failure and readmission in the patient who received the clip in the severe tricuspid regurgitation. Good study. Positive outcome, which is a secondary outcome, but it didn't meet the primary outcome. But again, this is a very short, this is an initial trial, and I think the tricuspid valve staging and also identification of severe tricuspid regurgitation and when we can clip that tricuspid valve is still to be defined, because we still have not too much knowledge about that valve. I think I'll wrap up with this way. This is just a summary of the ACC 2023. Thank you for joining me today, and stay tuned for our next video. Thank you so much.